Okie dokie, so sorry, I'll just mute you all again. There we go, brilliant. So if you have got a spiky ball, guys, just grab the spiky ball and just, I'll show you anyway. It's worth just taking you through it in case you've not got one or you're new to the class. So sometimes if your hamstrings are super, super tight, it's really quite nice to just release the foot. I massage quite a bit, and it's amazing how many people have plantar fasciitis. The calves get super tight, the Achilles get tight, bleeds into the heel bone, into the plantar, and it just gets all that nice kind of sensory, so good for peripheral neuropathy. So you just want to really give it a little bit of welly. Some of the massage balls are super hard. This one's one of the softer ones. So yeah, just be mindful if you've never used them. I don't have any allergies apart from to penicillin, which is a bit of a bummer. But sometimes, when I first started using the ball, I used to get quite itchy feet. So yeah, just be mindful that you might start itching a little bit when you first start using it. It's just everything working. So it's always nice to release through the foot. If you have tight hamstrings, I would check the hamstring stretch first, roll under it and check it again and see if you can go that little bit further. Okay, so like I say, guys, let's do some little arm circles through a short lever. So we'll do 8 in one direction, and I'll just chat for a sec. So yeah, I've just put, like I say, a YouTube one on, which I think will be absolutely similar level to what we've been doing. Little bit more core work that you might not have been used to, like single leg stretch and the other way. So again, maybe watch it a couple of times. Maybe start with a one leg, single leg, as opposed to a tabletop. But yeah, and I'll be laid on the beach, so please feel free. People say just relax, but please feel free to email me. I'm quite happy to respond. And the other side. And again, see what I mean? My foot's itching already with doing that. And 3, and 2, and 1. And then go in the other direction. 7, 6, 5, 4, 3, 2, and 1. Okay, if that felt good and enough, then continue with that. If the range of motion isn't fully there, if it is, then see if you can just gently bring it up, even if it's not into full flexion, even if it's just to there, guys. We want to really start moving through that shoulder joint, nice and slowly. And again for 3, for 2, and for 1, and the other side, and again, 8, so 7, just have a little listen, just one side sort of do a bit of crunching more than the other, and for 4, for 3, so Emma, if you've done Pilates before, you'll have probably checked all your range of motion. So we'll do it now. We need to check in everything, but it's good for everyone there. So we're just going to go up into front raise. So we're just going to go up into flexion halfway to start with. Come up onto the calves if you can. If balance is an issue, so see how this feels, Emma. If you want to just grab hold of something and just do one arm into flexion, that's good. Doing single arm is a really nice reflection as well on, or an indication, should I say, of if one side's sort of got more range than the other. And switch it if you are doing one at a time. And working through the calves, so really getting the ankles nice and strong, which will increase that bone density as well. And for 3, for 2, for 1. Switch again. This time take it into full flexion, or you can do both arms at a time. Now really start to think about the core. What often happens when we take the shoulder up is that the ribs want to come up and out as well. So we're trying to keep that core strong. So we want to think about rib cage in and down. And again, for 3, for 2, stop the calves moving if they are absolutely going. And again, and 2, and 1. So the shoulder joint can flex. Let's do a little bit of abduction. So again, just up to shoulder height, tight through the tongue. Just up and lower. And 2, someone's starting again. So I can't believe it, we're a week soon since we're on. Again, and again. Again, if you really want to work through calves, you can come up. We're going to stretch them out. But if you're not used to it, then just do your arm action. And see if you can take it overhead. If you can't, again, don't worry. Sometimes with axillary web syndrome, frozen shoulder, abduction can be really tough. And 2, and 1, the other side. Yeah, if I look a bit boss-eyed on YouTube, guys, it's because I'm looking at the Zoom camera. I'm sorry, just to there. And not the YouTube camera, so sometimes I think I must look a bit like that. And again. And all the way up. Or again, you can come into calf raise for 2, for 3. If you really want to work on the balance, you can obviously come up the whole way. And 4, and 3. Always do what feels comfortable to you. And 1. Well done. Good work. Okay, let's take it into that protraction. So we do lots of, remember, we do lots of kind of trying to open up through the scarring, the balance as well. So I'll try and keep the balance from level 1 up to level 2. So at least you've got that kind of more modification. So take your arms out. And what I want you to do is just keep the core connected and squeeze through. So stretching any scarring. And again, and for 2, and out, and for 3, and for 4, and for 4, and 3. Good work. 2, and 1. If that feels enough, continue. Or see if you can take it, elbows behind the back, and then take it into that. Just go easy because it's quite a pull, particularly if you've got any cording. And 2, and again for 3, and 4. 4 more. It's quite sad, isn't it? 2 of the Haven branches are closing. But I'm going to be stuck with me for a while, guys. So. And 1. Well done. And just give it a little bit of yeah, so we'll just do a nice little stretch and then we'll do a little bit more mobilisation. So we'll just stretch the deltoids out, so the big shoulder muscle. So take your arms out, right arm, left arm comes underneath and just pull it across. You can bend it if you prefer, whichever feels better. Just take a breath in. And again. One more. Well done. And the other side. And again, just pull it across, breath in. So yeah, guys, please feel free, to, like I said, email me if there's more of something that you want or less of something. Then obviously everyone's got different needs and different wants and all the rest of it. But I will try and do as much as I can to accommodate. So we're going to take into our rotator cuff. So if you feel that your range of motion is back, we're going to do some exercises again where you can try and use a small weight. If you can only get up to there with flexion, or you can only get up to there with abduction or rotation, or a little bit of extension, don't use the weights until you feel that your range of motion is back. So a good one to try if you have got some weights and you feel that your rotator cuff muscles are working again, is to take some little ones. These are only like literally, they've not even got, I think it says 2 pounds, so it's not even a kilo, this one. So always start on something like 1 pound, Never increase the weight at the same time as you increase the reps. So always start with a small weight to begin with, and if you're increasing the weight, keep the reps the same. So again, it's a good one this because it makes you think about the rib cage. So we don't want the rib cage to separate. So I don't know how many of you've got children, but if you have, can you remember that you get like that linear alba line and sometimes you get what's called diastasis recti, where the muscles, abdominal muscles, separate. So we want to try and keep the ribs in and down. And again, they're pretty light, these. So these ones should be okay. And again, for 4, for 3, for 2, for 1. Arms down by your side. Again, if you don't want to use weights, you've never used them, or you're worried about using them, just think range of motion is more important to begin with. You can get strong later on. If you haven't got your range back, you will only get strong in that particular range of motion. And again, for 2, try and keep that length through the crown of the head. 3, 4, 4, 3, 2, and 1. Only if you are used to, keeping shoulders like this in abduction, do the next one, try it, or take the weights away and just see. If you can't touch the hands onto the shoulder, that is usually an indication of a rotator cuff issue. All our rotator cuff muscles insert into the scapula. And so really nice without the weights as well, just to get that lymph flowing. And 2, and 1. Well done. And then similar reflection, just up and down. And again, for 3, for 4, for 4, for 3, for 2, and for 1. Well done. Into extension. So again, without the weight, all you're going to do is just push up, yeah? Keeping everything nice and still. If you want to try with the weights, just push and push. You're not bringing the hands back in front of the hips. You're just pushing up and pushing up. And again, for 8, for 7, for 6, for 5, for 4, 3, 2, and 1. So if you introduce weights, always check afterwards how everything feels. Like I said, start really, really low. And again, into a tricep one you can try, or without the weight, just use your own body resistance. So take the weights into the rib cage, just gently up and in, and 2, and in, and 3, and 4, and 4, and 3, and 2, and 1. Well done. Good. So I'm going to challenge you a little wee bit. So again, make sure you've got something to hold on to, hon. So we're going to put the weights down, and we're going to think about now headlights on the hips. Okay, so headlights shining forward. We want to avoid that lateral tilt, and we don't want to be postured like that. So we don't want to be in an anterior or posterior tilt. We just want to be nice and neutral. Shoulder blades down, length through the crown of the head. Take your hands to prayer position. Take your left leg forward. Keep drawing the core in. Again, grow a little bit. I've said that before, haven't I? I thought when I started Pilates I might grow 2 inches, but I'm so sure. Maybe half an inch. Okay, so we're just going to take it up and lower and up. So again, please, obviously, don't compromise safety, hon. So make sure you're just holding something. Sometimes it's just nice to kind of have something there. And my ladies, just to make you feel better, Emma, my ladies at the Haven, their balance has improved, honestly, amazing. It's so good. And a few of them have had peripheral neuropathy as well. And just definitely hold on for this one. Circle through. If it's too much, you can try and circle on the floor. Yeah, like that. Or circle through the ankle joint. Slow it down. How does that joint feel? Remember, that's where our movement patterns live, into our brain. So obviously peripheral neuropathy, where the messages are not always getting through. And obviously because our feet are the furthest part away. And relax. Well done. And the other way. I've had lovely Serena around for a coffee this morning outside, and I walked into something the other day and pretty sure my middle toe's broken. Well, we think it might be. And again, the other side. So again, just lift and lower. Lift, so have a little bit of softness in the knee. Not a straight leg, but not a full flex one as well. And just lift and lift. Keep drawing the core in. It's the core that really helps move that leg action. And hold it up. Circle. Circle. Don't ever underestimate the beauty of circling the joints. So if you think how often you circle the shoulder area now, and then we often neglect our ankles when we think we are stood on our feet a lot. And gently down. Okay, this time a little bit different to what I want you to do is just stand nice and tall, and I just want you to raise your toes. I hope you can see that. Raise your toes and spread them at the same time. Let them come down. Raise and spread. So that's splaying. And again, so imagine these are my feet. I think you can see, guys, but raise, spread, and lower. Raise, so keep them really nice and wide. Imagine these are my toes. And lower. And again, we've got, I always have little problems with feet because I'm constantly on them. So I work a lot with lateral stretches and so much better. Just make the mistake of getting a glass of water at 1:30 in the morning in the pitch black and walking into things. And 2 and 1. Might have said a little expletive. Okay, well done. Okay, so now just a nice one because we've got a few people. I think Sue, you were saying about peripheral neuropathy, and a few people, now Angela, you were saying that the stretches help a lot with the feet. So all I want you to do is try and get used to posture. So try and get used to always thinking about shoulders down, length through the crown of the head. And if we work on what we call proprioception, so the map in the brain really knows what it's doing without having to really look, know where we are kind of in space and time, I guess. So this is the foot. Try not to look down at your foot. But now imagine, do it, that the foot is laterally turning. And take it back down again. Take it out. So for some people you may feel nothing at all. If you haven't got any tightness through the ankle joint, the outside of the ankle, you might not find much at all. This is the most beautiful stretch for me. I can feel the whole part of my lateral foot stretching out. So even if you can, believe me that it's opening up the joint. And again, and 1. Some people are tight the other way, so turn it in. And back. Just be careful with the knee on this one. So again, take it that way. I carry most of my tension, even when I have a massage, and you can tell when you massage people that a lot of people either internally, medially tight, or go lateral again. Mine's always lateral, and that's because I use my external rotators a lot with glute work. And 3, and 2. And 1. Well done. Just keep that foot nice and leg nice and straight, guys. And just take the chin to chest and just gently, not much, take the hips backwards, just gently start. If you want to bend that back knee, that feels easier. So from this angle, bend the back knee and just gently start coming down. If I'm honest, my right hamstring at the minute is really tight. So if I'm honest, I should probably stop there because it's about a 3 on the stretch. So just because you can get to the floor doesn't mean you should get to the floor. Yeah, it should only be a 3 to 4 on a stretch. Yeah, not a 10. And just feel. And then just see if you can internally rotate the foot. Does that change the stretch at all? Bring it back to centre and externally rotate the foot. So you're taking the foot, inversion, eversion, in and out, keeping the ankle moving, and then bend the knee, and slowly restart back up. Nice and slow. Okay, well done. To the other side. So again, what's our foot doing? At the minute it's doing nothing. Now we're not looking at it, but our brain knows that our ankle joint's going over and back. the more we move through our joints, the clearer the messages get to the brain. So if we stop moving things, which we often do when we're in pain, it's the worst thing to do, but it's a natural protective mechanism. So we always want to try and keep moving, obviously without pain, as much as we can. So for this side, it's not as deep a stretch, so you're really taking that over. And again, and then take it a little bit in, and back, in, and back, and again, and again. And good ones for feet, Emma, as well. You know, trying to like roll like a face cloth, I guess. You can do it with a marble, but it's quite hard. And trying to pick it up, so scrunching the toes, you know, we wave them away, so scrunching them and waving away, scrunching, waving away, scrunching, and then trying to pick something up. Take it in, take it out. They're really good. Okay, well done. And again, just gently either soften the knee, or you can go into a full split stance, chin to chest, just gently down towards the floor. Noticing if this hamstring is tighter or not as tight. My left one's much better than my right. And again, just feel that stretch. You can turn the foot in, turn it out. In and out. In and out. And bend the front knee. And slowly restack. Back up. Well done. Good work. Okay, sometimes, like I say, we neglect the lower part of our body, particularly the feet, so I hope you enjoyed that a little bit. And we're just going there. So just, I'm sure everyone is familiar now with the clock face, thinking of the pelvis, so 3 to 9, side to side. And some people are very tilted one way or another. And then take it into forward and back. So a little bit of softness in the knees, posterior tilt, anterior. So if I was doing a quiz, guys, I would be saying if we were doing abdominal work, what is the best position to be in? Is it an anterior tilt, tipping the water onto the floor? Is it a posterior tilt, spilling the imaginary water on the tummy into the belly button? Or is it neither or neither? It's actually neither or neither, isn't it? Yeah? But it's much better to be slightly tucked than like that. We never want that big gap through the thoracic area. Yeah. Okay, so just give yourself now just a pelvic circle, noticing if there's any tension at all. One of my lovely clients in my 12:30 class, who we know quite well now, we call her our squat lady, Lorraine. She's lovely. It's her birthday tomorrow, it's the 60th, so we were just dancing on the early class to Stevie Wonder. Classic. And because it's a birthday, we did lots of squats, which you might think is cruel, but she absolutely adores squats. And 2, and 1. Okay, so just nice to get that moving. So we're going to do some squats, just because they're so good for hip mobility, they're so good for glute strength, just, yeah, one of the best. And not quite, because I've got a poly toe, we sometimes do lunges, but lunges are a bit more difficult on people's knees. So we're going to do some of those, and then we are going to do some really nice kind of mobilisation work, and maybe another couple of balances. So you can do a closed position squat if you prefer, like this, or slightly wider, more of a sumo squat. The important thing is, for those of you that are pretty new to squatting, we don't want to do this, yeah? So you'll see people, it's my pet hair, I see people in the park doing it, I'm like, I want to run over, and you'll see people doing that. Yeah, so you want to think, it takes a bit of a leap of faith, but you want to kind of think about like the hips almost coming backwards. You should be able to lift the toes if required, so the weight goes into the heels. So again, tie it through the tummy, and you take it down. So depending on what you want, you can, with your arms, you can do anything. You can just hold your arms up, like this, but bearing in mind that we want that lymph to flow, it's quite nice to do the action. So so imagine you've got a wall behind you. Yeah. Or you've got Kim Kardashian backside. And and you want to push it. Again, so you're pushing that bum backwards. Push backwards. And again, let's go for 8, for 7. So please don't fatigue. By all means, just stand and watch. If you start getting tired. And for 4, for 3, for 2, and for 1. Well done. Back into centre position. We'll just keep with that strength work. Grab hold of something if you're not used to balance. We're going to work through the side muscles like we often do into abduction. They're not easy these. So people say, oh, you make it look really easy. And it's not. Please don't think that it is without anything to hold on to. I've been doing it. It's what I do for a living. So go easy, guys. Be kind to yourself. Yes, so grab hold of something. Even if you decide to let go, at least there's something there. So again, if you are really familiar and you want to strengthen through the shoulders, take them out or bring them into prayer position. Draw the core in, grow a little bit, and lift, and lower. Lift. So working this supporting leg, working through that ankle area, strengthening the ankle bone. It is one of the most common breaks, ankles and wrists. And that's why 4-point kneeling work is fantastic for osteoporosis. Not so great if you have lymphedema. And again, and for 4, for 3, for 2, and for 1. Well done. Take it to the back into hip extension. Give yourself a slight, remember when we're doing the tilts forward and back? Give yourself a slight posterior tilt, so tailbone towards the heels. Take yourself forward, arms like that, or in fact, just hold on. Point the back foot, so a pointed foot will work the calf, the hamstring, and the glute. Hip extension, a lot of glute work, which will help to support that lower back. We're not doing loads. 4, 3, 2, 1. Just hold it. If you want to try and balance, you can. But again, just go careful. And if you can, take it into this stretch or this one. This is really hard for some people, I appreciate. So if you can't do it, just watch. I think last week I showed you how you can get a band. So you could take a band and it just helps people pull a little bit through. There's much better hip flexor ones for people that struggle. I'll show you them when we get down on the floor, guys. Okay, the other side. So again, drawing, just notice if you've got more or less strength on one side. Again, shoulders down, core connected. Either arms out or hold on or to there. I'll just hold on to there. And 2, and 3. So working this side, glute me, glute me. I don't know what it's like where you are, but I think the sunshine is beginning to come. I think you're in for a bit of a heat wave, guys, while I'm away. And 5, and 4, and 3, and 2, and 1. Well done. Take it to the back. Tuck the tailbone a little bit. Lift, lift, and again. 7, 6, 5, 4, 3, 2, 1. Hold. So I am challenging you quite a bit today. So please, like I say, feel free to just rest a little bit. If you're still really unfamiliar, not unfamiliar, if you're still a bit worried about, things like neutral pelvis and shoulder placement, things like that, then there's not, you can always dial into that new Thursday one, and we'll go back through basics again. And just hold and relax. Well done. Again, just give yourself a little pelvic circle. And circle back the other way. And good work. Okie dokie. Let's do a little bit more for the shoulder, guys. Okay, so just want you just to feel nice and just resting. In fact, just move side to side. Side to side. Just move your arms up. 4, 3, 2, and 1. And then take it higher. Higher. other side. So again, just forward and back. Oh. Yeah, and 4, 3, 2, and 1, and to the side, and again. So all these ones are really nice for that lymphedema, whether you're moving, actions, circling. So try a sideways figure of 8. So imagine an 8, like number 8, on its side, and you're just taking it on its side and circling back. Anything that's getting the mobilization of the shoulder joint is good. Yeah? 2 and 1. Well done. The other side. So again, does that make sense? If you think of a figure of 8, you can do them to the front, obviously. Yeah, like that. Or across the body is nice as well. Or to the side of the body. So if in doubt, always think about circles, and then usually can't think of an instance when circling is not good for the joints. And relax. Well done. Okay, time always goes too quick for me in this class, guys. We're just going to do some roll downs. Yeah, if there's any, I don't know if any of you how you're feeling about if you're going for long walks, kind of trying to get out, get some fresh air. So if you have become kind of where you know your go-to place is like just going for a long walk or even a little jog or whatever, it's really important that we stretch out the back of the legs. So roll-ups will do that. So a little bit of softness in the knee. Take the hips backwards, mobilising the spine, chin to chest. As we let your arms become very heavy and the head. As we just start going down towards the floor. And just letting the sit bones come up to the ceiling. Take a breath in. And slowly restart. Now, if you have issues with balance, I wouldn't try the next one because IT band stretch is really quite difficult on the balance. But it's runner stretch, so if you have got very tight hamstrings, it is really good and for the side of the white connective tissue. So take the back. If not, just do your normal roll down. Chin to chest, keep coming backwards as you let the weight come forwards. Let the head hang. Oh, and just feel that stretch. Take a breath in. Last one, breath in. Slowly up. And gently down. And again, remembering the vertebra, the little joints in between. We want to keep that back nice and mobile. Take the hips backwards, chin to chest. Keep taking the hips back. Taking the weight forwards, letting the head and your arms become very heavy. And feeling that stretch as you let the head hang. Take a breath in. In through the nose. Out through the mouth. In through the nose. Out through the mouth. Last one. And slowly up. And well done. I'm just going to open the door. Window, guys, it's just getting really hot. So what I'm going to do now, we are going to do a little bit of spinal flexion and rotation, and then we're going to get down on the floor. I'm just mindful, because I'm away, I just want to show you, I think I showed you last week, but I just want to show you the roller, some abdominal work, and more importantly, some work for the shoulders. And then at least, hopefully, I'll get that done before the video sometimes runs out a bit earlier on YouTube, at about 55. So I want to make sure that that's on. So all we're going to do before that is just a little bit of rotation. So I just want you to take your hands either to Cossack, or if it doesn't bother you in abduction, you can take it to here. And we're just going to draw the tummy in and just gently try and just rotate. Take a breath in through the nose. Exhale back. Inhale to prepare. Exhale round. Try and keep headlights on the hips if you can. Inhale. And back to centre. Try it like this. And again, inhale to prepare. Make sure the shoulders haven't hiked up. If they have, take them down. Exhale. Inhale to prepare. Exhale, centre. And again, inhale. Exhale round. Inhale to prepare. Exhale, centre. Good. Let's do that now. So Emma, just go careful with this one, hon. Don't feel that you need to do it. The sun's shining in, so I'm hoping the camera's okay. A lot harder, this one. Doesn't look hard, but believe you me, it is. So if your balance feels a bit off, just don't do this one. Just go back into parallel feet. And again, draw through the tummy, take it round. Inhale to prepare. Exhale, centre. Inhale. Exhale, round. Draw the navel in. Back to centre. Good. And then into abduction. One more each side. Inhale. Exhale, round. Inhale to prepare. Exhale, centre. Last one. And round. And back to centre. Good work. And then in the next one, all we're going to do, so we've done quite a bit of rotation, we're just going to hold it there. Draw the tummy in. And again, so Emma, again, just see how it feels, hon. If you feel, and only if you feel comfortable, okay, make sure you've got something to grab hold of in case, if you want to. We're trying to improve that vestibular system in the brain, and obviously we take a lot of visual, a lot of surroundings in visual. I think it's about 8 to 7% if I remember correctly. So see if you can just gently close your eyes. No, do one at a time. And both together. Relax. Well done. And just before we get down, I thought I'd done walking and wise today. I can't remember if I have. I hate not doing this one. So it doesn't matter if we have done it already. We'll do it one more time. So I just want you to place one hand on the forehead, one on the sacrum if you can get there. If not, to the front. So if you've recently had breast cancer, sometimes getting that arm behind the back is super hard. So again, you can always take it to the front. And again, let's go 8, let's go 7, let's go 6, let's go 5, let's go 4, 3, 2, and 1. Well done. Brilliant. Okay, so if you don't feel comfortable on the floor, then please just try and just watch the next bit of the session, and maybe hopefully be able to stop and start it on the video. So I'll just call it, what shall I call it? Well, you'll notice it'll be just rehab exercises for post-surgery or something like that. It'll be obvious that you can watch it, guys, and do it. And it'll be the last one that I put on today. So I'll put today's date on as well. So what I want to do is show you, we've done, I'm pretty sure we've done them, but honestly, this week my head's been a bit of a shit. I've been so busy. So we want to, whenever we've got roller, most people, all my Pilates ladies at the Haven, except one, love the roller. It's their favourite piece of equipment. They feel that it really opens up their shoulder area, particularly all the pectoral muscles. One lady is not keen on it. sometimes you have a bit of a barrier, don't you, to things. So try and do the exercises that I'm doing now. If you've got a roller, I would always do them on the floor first, yeah? And then, so let's all do them on the floor. And then I'll show you them on the roller. And you can sit and laugh, or have a go if you've got one. I know a few of you have now. So if you just bring yourself down onto the floor, and I'll just explain again that neutral spine. So whenever we're looking at doing any abdominal work, we always want to think about rib cage. So place your hands onto your ribs. So your fingers, you can do this if you stood up, if you don't want to come down on the floor. Just make sure the fingertips are touching. And what I want you to do is I want you to inhale and then think, remember the old fashioned, you don't see them very much, do you? Unless you go to, sometimes in Edinburgh they have them along with the bagpipes, you know, the accordions that come in and out like this. So think about the ribs coming up and out. So if you place your hands with the fingers together, then inhale and let the ribs come up and out. So that happens. Ribs up and down. So if you've had children, sometimes you get what we call diastasis recti, that separation of the ribs. So again, of the abdominal muscles. And then I want you to exhale and push the ribs in and down. And that's where we want to keep them when we're doing abdominal work. Yeah? When we take arms overhead, what often happens is the ribs come up and out. Again, try and consciously keep them down whenever the arm goes backwards. We're not taking arms back today, but just always remember that. So ribs are down. Okay, what that does then is create that lovely connection of the thoracic spine on the mat. Think now about the lumbar spine, which is the lower spine, before you get to your bottom. And just imagine now that you've got a little grave and you want to just gently squash it. Yeah, so we go into what we call a posterior imprint. So if you were laid on the sand, not rubbing it in guys, but if you were laid on the sand, imagine that you had an imprinted spine and then take it forward. My 15-year-old, I was just saying to Serena today, forward and back is like super. It's like got a 20-pack. It's just so thin, but like muscly as well. He's got a spine that you can really see. So imagine the whole of your spine. And as you go into imprint, the whole of the spine is on the mat. And as you release it, the whole comes away. And then find that mid-pound where the ribs are down, the thoracic spine is on, but you've got the tiniest little gap. Obviously, if you're what we call lordotic and you walk with a slight anterior tilt, your jeans are always a bit big on the waist. That is going to be, when you go into imprint, that's going to be, you're still going to probably have that gap. Likewise, some people are very flat-backed, and it'll be difficult for them to basically get that movement as much. So try and just think about pubic bone and hip bones are level. We never want the hip bones higher than the pubic bone. I hope that makes sense because that happens. Likewise, pubic bone shouldn't be higher than hip bones because we don't want to be pushing the lower back in too much. So, to start off with, sometimes it's nice to be in a semi-imprint position. So lengthen through the front of the chest, walk the hands down, and then just gently bring the right leg up to tabletop. And if you need to go into imprint, you can to raise the other leg, or just keep it neutral, draw the tummy in that little bit more, and can you bring the other leg up? That might be enough. To start with, you might just want to practice and think, gosh, that feels hard work. You might want to literally keep one leg up, float it down, draw the tummy in still, raise the other leg, and take it down. Think about the neck now. If you're seeing more of the back of the room, give yourself a little chin off. So keep everything connected. We don't want the pelvis to be tilting forward and back. It's harder than it looks to lift up and down without moving through the back, without going, yeah, that's easy to do, but actually keeping everything super still is really hard, and it will start working the core. Same with when you move the leg forward and back in. Sometimes I like to go back to basics and realise how hard it actually is to keep that back in alignment. don't concentrate as much. Draw the tummy in, push the ribs down. Again, that tiny little gap, you can put your hand there. When you take the leg out and back in, out, there should be no movement whatsoever in that spine. It's much better to do things precisely. It will work so much harder. You'll see people often in class and they'll go, and it's literally, they're going in print and not much is happening. So, that is like the basics of abdominal work, rib cage down, navel to spine connection, neutral spine. You can do them on the roller. So I'll just show you, because if you are practicing, if you work on computer a lot, you are obviously a little bit more prone to having very lengthened traps. They become a bit weak. You become very tight through the pectoral wall. So what the roller does, and obviously if that's scarring, it gives this lovely length through the front of the chest. So, again, if you are on the roller, or if you're thinking about buying one, I love them. They serve as a good balance as well. Then you want to, for me it's easy peasy because I'm short. Oh, I don't like that word, but I'm little. So I'm only 5'2", so I easily fit on. I think that's on a good day as well. So you want the hand, but literally I just hit this silly bubble out. So you want to make sure that the head is always connected. I've got loads of people in my class, pre-COVID I did, they're all on Zoom now, most of them. But even my guys, my 6'5" guys just about fit on. And you also want to make sure the last vertebra is on as well. So again, in this position you'll see already how you kind of get that length through. Now if you're suffering a little bit with forward shoulder, then it's a little bit harder. Sometimes it's nice if you can balance to turn the palms up to the ceiling. If that's difficult, you just want to do as much as you can. So, once you're on the roller, what can sometimes happen is we forget all about our neutral spine and we start arching forward. I don't know if you can see, guys. So again, always give yourself a pelvic tilt forward and back. Push the ribcage down. It's really lovely for proprioception, this. So you bring the right leg up, draw the tummy in, take it out, and in, out. One of my lovely ladies at the Haven who'd had a brachial nerve damaged, she used to do the abdominal work sometimes, but sometimes when she was tired, she used to say, just leave me here, Jo. And I used to just leave her there laying. And she used to just feel that it really opened up the front of her chest. And 2, and 1. So again, you're using the abdominal muscles to take the leg out and in. And I think because you're concentrating, it just takes your mind off of all the other stuff that must be running through it all the time. Particularly if you're still in treatment, guys. And then back. Yeah? Or you can try. In fact, before you do that, what's a nice one to do, again, to fire up the core, is just to raise one foot, raise the other foot, and notice how much more difficult it is to raise one more than the other. And then this. I find this really hard. I find the full exercise much easier. So raising up, not too bad on the right side, and not great on the left. You see how I'm wobbling? But again, I'm using the core. My left is never great. Yeah, so always like that. Or you can take it to double leg tabletop if you feel really strong. And I found at the Haven that the ladies find this super empowering. I had no intention of them ever doing this, and within a few weeks they were like, can we try it? Yes, this move, drawing in. Again, no movement in the spine. I don't know if you can see, guys, but my back's not going in and out. It's keeping. And relax. More importantly, I don't know if that stopped. Let me just see. Oh no, I'm still on. I'll do the camera. Great. Let me quickly show you this. This is my favourite. So we can take our arms down by our side. We can try our abduction. Might get to there, guys, and that might be enough. So sometimes when we push through 80 to 120, it's a little bit easier. But ideally we want to get to 90, turn the palms over, see if we can. Can we go any further? Some people get it all the way round, but don't worry if you can't. It's quite nice for that. Or taking the arms up to ceiling, protract and retract. So protract the shoulder blade away and retract it back. And you really want the shoulder blades hugging. And then practice that rib placement. So ribs down, and can we take our arm backwards? You might only get to there. You may not have full flexion. Don't worry if you haven't. Don't force it. And eventually you might never. I've got lots of people, lots of clients that have never had any kind of surgery and still are nowhere near the floor. So don't be too hard on yourself if you're only getting to there. And you can do what we call angel arms, so to there, circle, and back up. Usually flexion is not bad, usually abduction is the most difficult post-surgery. And relax. That's the tutorial for the roller. There's lots of other stuff you can do on them. And then, nice to finish with, guys, just chin to chest. So chin towards the chest will elongate cervical spine or cervical spine. I always forget how to say it. And then just gently. And back. So we've got, if you think, so the pivot, 1C, 1C2. And we've got 7 vertebrae in our neck. And often with surgery, the neck can feel incredibly tight. So it's nice, and you should get a stretch up through that sternocleidomastoid, the levator scapula. Really important for necks to keep moving them. And again, back to centre. I can show you all sorts on here, guys. We can do our puppet arms on here as well, which is nice for that internal external rotation. But it's 3 o'clock already.